Right. We will call the health committee to order. It is September 1st, 2020 at 9 a.m. Would you call the roll, please?
Oswald?
Yes.
Whitlow?
Here.
Curtis?
Yes.
Barr?
Yes.
May I have a motion to approve the agenda?
So moved.
Second?
Second.
And all in favor say aye. Opposed? Motion carried. All right, let's go through, you've been emailed the claims, so has everyone gotten those? Okay. Can I have a motion to accept the claims? Second? All right. Well, we're gonna take roll.
Oswald?
Yes.
Whitlow?
Yes.
Curtis?
Yes.
Barr?
Yes.
Motion carried. Any public comments? No public. All right, we'll hear from Dr. Yusuf, please.
Good morning, everybody.
Good morning.
So August was a very busy month. We received 11 dogs and 5 cats, 2 bats, and the bats are kind of negative and got nothing was so far. We had a couple of cases like animal abuse. We took the dog from the owner. We sent it to Husky. The dog is Husky dog. We sent it to a Husky shelter in Iowa actually. So the best one for him. Unfortunately, it was kind of like the owner filed a case against to get the dog back. The case still in the court, and if you see here, like, the claim, like, the mileage was high because we had to meet with them halfway. So I think the animal officer drove like 150 miles, but we are getting this money back. If he wants his dog back, that's what the city attorney said yesterday. He has to pay for the transportation, not only for the pickup, for the mileage and everything. And as far as I know, like, he's gonna pay a big fine, like $2,500 to get his dog back. The other case is a dog always lives outside, unvaccinated. He doesn't have rabies vaccine. Neighbors complaining that the dog is a big dog and he can bite any of their kids outside. We fined the owner 3 times. He didn't respond to any one of the tickets. And we got the authority or permission from the city attorney to pick up the dog from outside. He was loose all the time. We got the dog. We put it at the clinic for almost 10 days now. And yesterday, after the, again, permission from the city attorney, he called me and said to release the dog back to him. We let him sign a paper that he's not gonna let his dog outside. Which person have a big doubt, that would be the case. So he signed a paper that if we find the dog outside again, it's gonna be the end, like we're gonna have the dog and we transfer it to another shelter, and that's it. So those are the 2 big issues, happening. There is another one, like people claim like last month that they called animal control, nobody answered. They called me, nobody answered. They called Lacey, nobody answered, which I don't think this is true by any means. If you look at the numbers of cases we received last month, it's a lot of cases. And my phone number personally, my cell phone number on the internet, on the website of the animal control. And I got phone calls from, you believe it or not, from Wisconsin, Chicago, car accidents, and they need to get, in the middle of the night, they need to get my advice, what can I do, which clinic, and all of these type of things, because my phone number online. So, unfortunately, the same people last month, the month before, the same people did the same thing last month. They try to claim that we don't answer the phone calls, which is absolutely not true. And I think Linda called Lacey and you said like nobody called you, right? Yeah, nobody. And that's all I have.
Well, thank you very much. Any questions for the doctor?
Thank you.
Oh, thank you.
All Okay, let's move on to our Iroquois County Public Health Department.
Good morning. So I have the summary report of programs for you with all of our numbers. I'll just pass that to you guys real quick. Thank you. So do you want one too? Thank you. So obviously you know that we're still in crisis mode with a pandemic. And my staff is extremely busy. I did not bring you, before we go over this summary report of programs, I did not bring you an updated grants and contracts list like I usually do. A lot of the state grants that would have ended on June 30th have been extended. And we've gotten a lot of different extensions on those. And because the state's busy with COVID, they aren't sending us grants to write. So far, I think we've only got 2 or 3 grants from the state for this fiscal year, which we're working on, but we have extensions on the other ones. So it's a little bit complicated, and rather than try to redo that whole form, I thought I'm not gonna mess with that. But if you have questions about specific grants and the numbers or the money, just come and ask. We did get the crisis COVID grant, which was around $41,000. That grant ended in June, and now we're working under the contact tracing grant, the COVID contact tracing grant. That grant is substantial, over $800,000 grant. With that grant, they have specific grant deliverables and requirements that we had to meet. So some of the things that we've done to meet that grant is we had to hire contact tracers. So we have one individual who is our vision and hearing technician, who was also our part-time receptionist, took a different job, so out of state. So we replaced that position and then hired that in as full-time, because that person's also going to do contact tracing, because we aren't going to be doing a lot of vision and hearing in the schools until after January now. In fact, the state is not even having their training classes. They used to have training classes for the vision and hearing program, and what they're doing now is they're going to send someone to us and do one-on-one training, but we're on a list. So sometimes between now and January that will occur. In the meantime, we're going to buy the materials and have that person study for their training. There's a 20-hour independent study that goes along with the becoming a vision tech, and another 20 hours that goes along with becoming the auditory technician. So they would have had to do that anyway. So we're proceeding with that first. But this person will also be our contact tracer for now. And then we have another person that we hired full-time. One of the requirements of the grant was that we at least attempt to find someone bilingual. We found a wonderful person who had worked in a physician's office, who knows eye care and knows our immunization stuff. And she's going to be a wonderful fit. And she's going to be our other contact tracer. And yesterday was her first day on the job, and we already used her bilingual services, so that was fabulous. It was really nice not to have to call the state and have to use the state interpreter services. But we still have a couple positions that we're trying to work out internally, doing some switching around before we hire, that are requirements of the grant. We're also working with Lyle and John on some space issues, as you can imagine. So we're working through all that. But as far as the grants go, that's a big grant, and the majority of that grant money will be spent on, obviously, on COVID investigations and COVID contact tracing. you know, when somebody looks at our numbers, if you look at the press release that went out yesterday, the press release said 336 cases. I got it here.
We have
300
336.
336 cases, yeah. So you have to remember that when we have 336 cases, those people are isolated. All of their contacts are quarantined. There are times when we have 500 people in quarantine that we're doing daily monitoring on. That's a lot of work. We also, when those people are quarantined, they're asked to stay home, to remain in their home and only leave unless they're seeking medical attention, which means that they can't go out and buy groceries, they can't go, you know, get things they need, and we are required by law to provide that for them. So so the good portion of the grant will go toward providing them for the needs of the people who are in quarantine in order to keep them in quarantine. A lot of grocery shopping, a lot of that kind of stuff. You know, if they have babies, you gotta buy formula and diapers and whatever they need to get through that 2-week period. But it's a grant that every county in the state of Illinois got. Some counties got lots of money. Some counties, there was a formula they used based on your population. So our allocation was over 800, and there are counties around us that, you know, I think we got 2.9 million, and Champaign got 5.9 million. You know, lots of resource money there to help with the pandemic. Yeah.
How far back do you go on this contact tracing? Just the first people the person that has been tested positive, just back one person?
Okay. Yes. So for example, Barb, do you mind if I use you for an example?
No, go right
If
ahead.
Barb tested positive, then we would contact Barb and do an extensive interview with her. We, you know, after we get done finding out how she's doing with her signs and symptoms and how she's managing, you know, and if she's ill and all that kind of stuff, then we would ask for her contacts. So her contacts would be anyone who was within 6 feet or shorter distance for 15 minutes or longer in the 48 hours prior to either her symptoms starting or when the specimen was collected for her testing. So those people that meet that criteria are placed into quarantine. So obviously, Barb is married, we all know Pete. So Pete would be a household contact. Now, household contacts are a little bit different than other contacts because Barb has tested, if she had tested positive, she's not positive. I can't tell you who has COVID, but I can tell you who doesn't. So, to my knowledge, Barb has not tested positive, but if she did test positive, she would be under isolation for a 10-day period, a minimum of a 10-day period. And she has to be 24 hours symptom-free and, or her condition has drastically improved, and there are different metrics we use for that, for her to be released from isolation. Okay, now, the person living in her household who is under quarantine because they are a direct contact, they have ongoing exposure the whole time that she's in isolation, right? They have ongoing exposure to her. Once she is released, so they are in quarantine during her isolation period, and then once she is released, an additional 14 days. And that 14 days is because it can take 14 days for the incubation period before signs and symptoms might show up. So a household contact is typically going to be in quarantine for 24 days. That's a long time to have to remain in your.
How do you know she's gonna stay there?
We don't. We do daily monitoring, and we ask them, you know, you haven't left the house, you haven't gone anywhere.
Well, yeah, but you're just taking their word.
We
for it.
do, but we can't police all those people. That's impossible. So we take their word. We do get reports once in a while from the community that says, I know so-and-so is under quarantine because they told me they were, and I just saw them and they went someplace. So whenever we get those phone calls, we follow up on them and we call that individual and say, you know, we had a report that you were seen there. Most of the time they say no. And then we have to go over with them the importance and really do a lot of education.
Why,
with them.
why just refuse to be printed?
So far, we have only had one family
Rebel.
that refused, and we had to get Jim Devine involved in that. And he, actually, got them to be somewhat, pretty much compliant. So, if the state allows that if the person doesn't voluntarily agree to be in quarantine, we can get a court order. And if they're court ordered, if we have to go to the length, now think about this, if we have to go so far as to get a court order to make them stay at home, we're also probably not gonna ankle bracelet on them. They're gonna have like a nice little device that warns us when they leave. And health departments have had to do that. We have not. Typically, when health departments do that, it's for tuberculosis cases, people that just won't stay home. But there have been some cases where that has happened with COVID. So it hasn't happened for us yet, but I have had to explain to them the consequences of their actions. And so far, we haven't had that be an issue. But as time goes on, people are becoming less and less cooperative. And let's be honest, people lie to us all the time. They absolutely lie to us, and we can't prove that they're lying. We know that they're lying, but we can't prove it.
Do you come to my house every day to make sure
You know, yeah, I'd have to hire 50, 60 new staff to do that. There's no way we can do that.
so it's strictly volunteer?
It is strict, well, it's volunteer until the point where we would have to get a court order, so really it's not volunteer, but yeah,
Is there a cost
we're
in
asking
that?
for that. What?
Is there a cost in that, having to get the lawyer involved?
Oh, yeah, but it wouldn't be a cost to us, because I'm telling you, if Jim Devine has to drag those people to court, he's gonna make them pay court costs.
Yeah.
I mean, I'm not gonna speak for Jim, I don't know that, but that would be my assumption, maybe I could be wrong about that. I shouldn't be speaking for Jim.
Yeah.
And I saw here where there's a bill at Burcott's for $2,000, is that food for them?
Yes, or we also have a different grant, remember, we have the ESS grant, the Emergency Senior Services Grant. So the East Central Area on Aging sent us $17,000 to use for elderly people age 60 and older, anyone age 60 and older who is hesitant to go out in the public with COVID because they, you know, don't want to risk exposure. And we can purchase things that they need, groceries, laundry detergent, toilet paper, if you can find it.
Yeah.
Which isn't so bad anymore, but those things. So we have that for our senior services as well. And that's a grant through the Department of Aging. And so
I think that came to over $7,000 last month, as I recall from the claims.
we might have, they sent us $17,000, and then for the first round, the first part of the grant, and then you can extend the grant. We got a second grant for 17, and I can actually extend 9,000 more if I need to. What that is, I think, is the Department of Aging, because we're doing all of our senior service home visits over the phone or by teleconference or Zoom or FaceTime or whatever. No one's going out into the homes because nobody wants to expose our seniors. They're using that, the state is using all that travel reimbursement money to help seniors with groceries. That's what they're doing. So, yeah.
The mileage that your employees put on going out to these people's places, is that paid from the grant also?
Yes.
So if we see mileage for,
I
I noticed there were quite a few mileage claims, and I was wondering if most of those probably were going out to deliver the groceries.
Right.
But that is paid by the grant
Yes.
and not by the county. Okay.
Thankful for that.
Well, you also have to remember that I budget mileage every year, so part of it is, Roger, not all of it.
Yeah, but.
But you also have to remember that I budget mileage for our senior services CCU program anyway, every year. So the mileage that they would be doing home visits, they may be doing deliveries to these people. But it's been budgeted. And that comes from either that comes from the ESS grant or that comes from the CCU money. So
Kind of have to,
so we balance it.
yeah.
We balance it. Well, so if it's a CCU client, then the money will come from the CCU funds. If it's a non-CCU client that we're spending money on, then that comes either from the ESS grant or with the money I budgeted
Yeah.
for senior services. So I can't say that that all of it doesn't come from tax dollars. There's probably a
Oh,
very
yeah.
small portion that does, but it would have anyway, because we would have been
Oh, yeah,
using that
it was-
to make the home visits.
The normal things that
Right.
you do for the elderly and
Right,
checking up on them and everything.
right.
Okay.
Does that make sense? Yeah. So before I get into this numbers thing, while we're talking about COVID and all this kind of stuff, you guys have other questions? What do you want to know? We'll let you
He
know.
has a question.
Yeah.
Tell us how you get it. Can I get it off of doorknobs? Or somebody said you can get it off of clothes if you tried on a dress and I came up and did it.
Okay, so this is a virus, and viruses typically don't live as long as bacteria does on things, you know. Honestly, I can't give you like an answer that says it was this long on doorknobs or this long on clothes. But the majority of the COVID-19 cases are spread through respiratory droplets where it's in the air and you actually breathe in that air that has those droplets. That's where the majority of the cases
Because
are
I'm
coming
too close to you.
from. Could somebody could I cough on this table and then immediately get up and have somebody come down and sit down and find my virus? Yeah, that's possible. That's why we ask you to wash your hands, wash your hands, wash your hands, wash your hands. Use hand sanitizer. Do all those things. Yeah, so yeah, it can live on surfaces, but you're at much higher risk because it's from the droplets. Which is why the masks really are helpful.
Like this?
Yeah, like that. That is important. Eric, do you have anything to add?
Another chart that we created is a daily confirmed case chart, something that shows our daily cases, as opposed to a cumulative over time. You've seen the cumulative, and have time to print out the copies for all. I can do that after the meeting, but you can share.
I'll come out and
And it shows you our different spikes and the fact that, early in the pandemic, we may have had small, but then as community transmission became wider, there's all bigger spikes. So it's another way to digest information.
August really moved up, didn't it?
I'm
Yes.
I mean, that's the most that it shows is August.
Okay, so let me give you a breakdown of that, Barb. Let me give you a breakdown of that. I'm missing my.
That's one.
Okay, so what's that one then?
This one is, some people tell me, well, these big spikes that you're seeing, they're just long-term care facilities. So I took the time and I extracted out data from long-term care facilities, the residents, and made that chart, which is the one you were just looking at, to show that once again, it's not just long-term care facilities. Although it is a significant problem.
So in March, we had 2 cases. In April, we had 32. In May, we had 98. In June, we had 25, in July, we had 82, and in August, we had 97 positive cases, which brings our total to 336.
And is that still 19 deaths, or is that gonna?
No, we're at 19 deaths.
So it's getting worse every month?
No, our worst month was May. In
Oh.
May, we had 98 cases, and in August, we had 97, so,
In June,
in June, we had 25, it went down. In
Yeah, it went
July,
down.
we went back up to
Yeah.
82. Say that again, Roger?
What?
In June, in May, we had, so March, we had 2 cases. In April, we had 32. May, we had 98. June, 25. July, 82. And August, 97.
Why do you think it's going up? Well, you know,
Why do I think it's going up? Because people are spreading it out and about, spreading it.
how are the schools doing right now?
Right now, to
Getting
my
cases
knowledge, we have cases in two of the school districts have cases. 3. As that as of today.
I think it was,
and
but one was very limited.
3 cases total.
In the school districts, 3 school districts that have cases, not 3 cases. 3 school districts that have cases.
and nursing homes.
Right now, we have
There's one,
just one.
one current outbreak.
One current outbreak in a nursing home, but we have had cases in 3.
We have had 3 outbreaks in long-term care facilities. 2 of those outbreaks have been closed. 1 is still ongoing.
Right.
So this is probably gonna go into 21, are you assuming?
Yes.
Absolutely, without a doubt.
The whole year? Nobody knows, do we?
We don't know what's gonna happen.
Do you feel it's getting better or worse?
It's getting worse.
I would venture to say, if the truth to be known, there's probably over 1,000 cases in Iroquois County, people running around asymptomatic. I really believe that.
Well,
Personally.
here's why that's a really good point, Jed, because you have to remember that early on, when we were getting some of our first cases, and I told my Board of Health this too, when we were getting our first cases, at that point in time, they were only testing people who were ill,
Very.
very ill. So first of all, you had to be hospitalized to be tested. Then they opened it up to the very ill people who were going to the doctor's offices to be tested. Then they opened it up to healthcare workers. Then they opened it up to emergency responders. Then they opened it up to testing to contacts. Then they opened it, so as we've gone, and now anybody can go get tested, right? And that's been that way for a while. So if you go back to the beginning, when we were only testing sick people, we had laboratory confirmed cases that had household contacts, or people they had been in contact with that were very ill as well. We did not, at that time, encourage them to go get tested. What I said to them as health department administrator, because at that point in time, I was still handling all the cases. Now my nurses handle them all, but, because I gotta get back to my job. But at that time, what I was telling people was, if we know that you're ill, if you've got a fever, a sore throat, a headache, loss of taste of sense and smell, all that went through the whole symptoms thing. If you're quarantined at home and you're able to manage without seeking medical care, you don't absolutely need to go see a doctor. Write it out at home. Don't go get tested, because at that point, we knew what they had, right? So if somebody is laboratory confirmed and their husband or wife or spouse or children have the same signs and symptoms, you know what they have, right? So we told them, don't go get tested, because we were short on testing supplies, so we didn't want to waste valuable resources. The most important reason we didn't tell them was we didn't want the healthcare community exposed. Every time you send them to a doctor's office to go get tested, or to the hospital to go get tested, you're exposing healthcare workers, and we weren't sure at that time how big this was gonna get. And we were trying to protect our medical infrastructure in our county, because we only have one county hospital. So, so we were telling people, don't go get tested. So there are a lot of cases that we know were cases, but we can't count them because we don't have a laboratory confirmation. We only count on our daily press releases anyone that we have a laboratory confirmation on. Or we do count the probables who have the rapid testing done through the rapid testing, and they're counted as a probable. But every person that's on this list as a number has been tested in one way or another. But all those people, you know, that were ill, that have been ill, and for the most part, we're telling people, if you are ill and you can write it out at home, write it out at home. Obviously, if you need to seek medical attention, we want that for you. But if you aren't ill enough to have to go out of your house to seek medical attention, don't go expose other people.
Pretty soon it's gonna become a question, is it a flu or is it COVID? You know,
I worry what will happen during flu season.
Yeah.
We are looking at flu season with great concern because if someone becomes, if someone's immune system becomes into flu and COVID-19, then that'll have more harmful effects.
Double whammy.
Double whammy.
So
So
what
get your
is
flu
your-
shot.
I'm sorry.
Get your flu shot. You can get it at the health department, actually.
That's what I was gonna ask. I heard that they're saying to get it earlier this year than normal. Is that true?
I think it's gonna be a matter of preference. You know, I tend to, in other years, so with COVID, yeah, if you are someone who's immune compromised, I probably would consider that. I tend to tell people who don't have an underlying health condition, you know, the last 2 years, we have seen flu seasons peak at the end of March, So, I tend to, this is just a personal preference, I tend to wait until about mid-October so that, rather than getting mine in the beginning of September, because I want my flu shot to peak, you know, a flu shot's only gonna last you for a year. Okay, you're gonna build up, have enough antibodies for a year. It might hold you a little longer than that if you're lucky, but most people, you know, you're gonna peak and then you're gonna start waning immunity. So I like mine to peak about March. That's my preference. So I wait. I don't ever get mine before the mid to end of October. That's in years past. With COVID, we're looking at something totally new here. I'm gonna change my mind to get it in September. I don't know that. I haven't looked at what the predictions are for influenza. Because COVID and influenza are two completely different viruses. You hear all these people that say COVID's just a common cold or it's just a flu. No, they don't know what they're talking about. Two completely different viruses. One's a coronavirus, one's an influenza virus. They're not the same. They may produce some similar symptoms. They're two different viruses. So,
Okay.
any other questions? Okay, so back to this report. This is just the typical report that we give you with all of our numbers on there. You know, I know at the county board meetings, some of the other departments have, you know, when they read the meeting minutes from the committee meetings, you know, they'll have, like, for example, the sheriff lists all how many jail inmates they have and how many calls they did. This is just too long to start listing on that report, but these are the same numbers that we, you know, provide to you every month. So if you see anything out of the ordinary or have questions, ask me and I will definitely go over those with you. You can see that we're back into the swing of the other programs as well, whereas for the first month or two, especially April and May, we didn't do a lot of our other programs. because we were so focused on COVID-19 and trying to be prepared for that, and now we're back to regular, normal programs plus COVID. And in September, you'll really see the childhood immunizations spike up. We'll have big numbers coming back from September. Our calendar looks pretty full. The October 15th deadline for schools for immunizations is coming up. And a lot of parents did wait and didn't get them over the summer because they were keeping their kids, away from.
Let's see, there were three rabies, was that dogs or?
Bats. I know a couple of them were bats. I think one was a dog. Hold on a second. Someone's got my notes. Yeah. So, it was 2 dogs and 1 bat.
Okay.
And 2 of those results have already come back negative, and 1 of them, we're still waiting on the results on. We'll have those probably today.
So in other words, these were tests, these were not.
No, when we do an animal bite investigation, that's different than a rabies investigation, because an animal bite means that the person has been bitten, but the dog may or may not have had shots. These are ones that there are no records. Like for a bat, obviously there's, they're gonna have to be tested, and those dogs that there are no vaccine records to look at. So those dogs have to either be quarantined or tested. If it's a stray dog and there's no home to quarantine it at, then we have the dog tested. If the dog has a home, even if the person hasn't gotten their shots, we do allow the dog to remain with the owner, and the dog is placed in a 10-day quarantine period, and then after 10 days, that dog has to be examined by a veterinarian and determined that there is no presence of rabies. So that's how that works. Does that make sense?
Yeah. Anybody have questions for Dee?
And you can always call us or stop by and ask questions anytime you have questions. We'll answer them the best we can.
Thank you, Dee.
You're welcome.
And Eric.
Thanks a lot.
Thank you.
Been doing
Do we
a
have
great
any-
job with a heck of a problem.
Thank you. We appreciate it. The staff has been working a lot of overtime hours. Now, with saying that, that the contact tracing grant specifically, a lot of that salary money is not salary money because a lot of that's overtime money, and that's what they gave to it for. I mean, the first line on that grant said uses overtime for staff because they knew every single health department's in the same boat we are. A lot of the larger health departments are running shifts now. So they've got a day shift and an evening shift, and I know Champaign's even thinking about putting in a night shift and running 24/7. I'm not, I can't do that. We can't do that. But, yeah, but a big, huge portion of that grant goes to salaries and overtime. Because you can't expect people to work 16-hour days for weeks and weeks and weeks and weeks and weeks and not pay them. You gotta pay them.
Well, certainly something that probably haven't ever seen before. so-
Exactly.
so-
And I hope that we don't see it again.
Yeah.
All right, have we got any old business before us? New business? We have a motion to adjourn? To, and,
Barb.
Barb? Who was first? All in favor, say aye. Aye. Opposed? Meeting adjourned. 9:30.
Barbara, have you noticed we're only putting these out, our press releases out, we're only putting them out now 5 days a week. We're not putting them out on Saturdays or Sundays. The nurses are still working on Saturdays and Sundays.
Yeah.
we have